So today's session will be on Caries risk assessment in conservative dentistry. These will be the contents. So moving on to the basic introduction. So dental caries is nothing but an irreversible microbial disease of the calcified tissue of the teeth, wherein you can see the demineralization of the inorganic portion and the destruction of the organic substance. So that is going to lead to cavity formation. So this is basically what dental caries is. Now moving on to caries susceptibility, it's nothing but the tendency of the host and the target tissue to be affected by the caries due to various reasons of factors. Now moving on to risk assessment, it is nothing but a procedure wherein we are going to predict the future development of caries before the clinical onset, even before the clinical onset of the disease. Now, always caries are shown to be associated with numerous behavioral, socio-demographical, environmental, microbiological, and host factors. In addition, every individual patient is going to have a certain set of risk factors, and that is going to present a challenge in determining the likelihood of the development of disease in the present or in the future. Now, patients who are going to possess several of the risk factors are the ones who are considered to be at high risk for dental caries, and this assessment is going to be used as a guide. And a patient who is at high risk of developing dental caries should receive aggressive intervention to remove or alter the risk factors as much as possible. Now, these are the caries risk indicators which are commonly seen. In case of non-oral risk factors, it includes age, wherein you have young or adults who are old patients who are more than 65 years of age, and lower socioeconomic status are the ones who are at high risk. And if there is a reduced salivation due to a medical condition or due to frequent intake of medications, or if there is a lack of fluoride during the tooth development and high intake of refined carbohydrates, a family history of some diseases or increased susceptibility to caries, and in addition if there is a decreased ability or debilitation to give self-care, so these peoples are the ones who are at high risk. And apart from that, in case of oral cavity, the presence of caries or the presence of the certain amount of fissures, and in addition a previous history of previous restorations which are not proper, or if there is poor oral hygiene, so these patients are said to be at high risk of developing dental caries. Now based on this, the patients can be categorized into low risk, medium risk, and high risk. So these include, in case of low risk, you are going to see if there is no carious lesion in the last 3 years, or if there is adequately restored surfaces, and if there is good oral hygiene, and if there is a regular gentle checkup and adequate amount of fluoride use, then the patient is said to be in low risk category. In case of medium, if there is any two of the indicators, then the patient is in a medium risk category, which includes any ongoing orthodontic treatment, or if there is an exposed root surface, poor oral hygiene, or if there is frequent intake of fermentable carbohydrate, or if there is inadequate exposure to fluoride. So these patients are said to be in greater risk, medium risk of developing dental caries. Now moving on to high risk patient, if there is presence of any one of the indicator, then the patient is said to be in high risk category, which includes any caries lesion in the past, in the previous 2 years, or if there is inadequate saliva flow, or if there is any enamel interproximal radiolucency, or if there is more than two factors which are seen in the medium risk category, so then the patient is said to be in high risk category. Now, the risk assessment of caries can be done with the help of pH indicator, plaque pH indicator, saliva pH indicator, plaque pH indicator, and the buffer of the saliva, and buffering ability of the saliva, the ClinPro caries diagnosis, the caries risk assessment tool, and the traffic light matrix model are the ones which are commonly used. Now, coming to the caries risk assessment tool, it was developed by the American Academy of Pediatric Dentistry in 2006. So, it incorporates three important factors for assessing caries in infants, children, and adolescents, that is, clinical conditions, environmental features, and general health conditions. Moving on, the traffic light matrix, it is a systematic approach for assessment of the risk factors which are going to contribute to the caries activity. So the concept is basically based on using the traffic signal colors, that is red, yellow, and green, to convey the different level of risk in both dentistry and health education. So the traffic light is the first element, as it builds on the existing risk assessment, as well as it includes an assessment of the patient motivation and lifestyle activity. So it allocates a threshold value for each risk category, and based on the risk factors, 16 risk factors, the score of red, which is high, yellow which is moderate and green which is low for risk factors can be based on predetermined criteria they can be given. So these are the risk factors based on salivary risk factors, diet, fluoride, oral biofilm, and the modifying factor. So based on this, our risk factor can be the risk of the patient for developing dental caries can be ascertained. Now the second element in this is the matrix. So this is going to help in assess the patient's present disease status and his attitude towards maintaining his oral health. So this is the scoring by which you can go for the second component of the traffic light matrix. Now based on next coming to the next system, that is the Caries activity test, which helps to identify the high risk individual groups and the need for a preventive regimens for a particular individual, and it is helps to ensure low level of Caries activity before any extensive restoration, and it helps to moderate the effectiveness of oral health programs. So the routinely used tests are the commonly used are lactobacillus count test, Snyder salivary reductase, Alban's test, ORA test, and Fosdick calcium dissolution test. Apart from this, less used tests are swab test, Streptococcus mutans level, salivary buffer capacitor, Streptococcus mutans dip slide, and the Streptococcus mutant replicate technique. Now moving on to the next risk assessment tool, that is a Caries risk assessment using classification and regression trees. So it helps to identify high and low risk patient. So it is providing a set of routes based on the predictable Caries predicting factors. So based on this, sensitivity and specificity are ascertained. So and according to this, the patient is ascertained based on which risk factors is going to come under. So for this Caries risk assessment, the following parameters are used, that is the age, number of decayed teeth, the DMFT index is used, the level of cariogenic bacteria, that is the level of Streptococcus mutans and lactobacillus, the flow rate and the buffer capacity of saliva is used. Now moving on to the next system, that is CAMRA, Caries risk assessment management by risk assessment, Caries management by risk assessment. So the CAMRA philosophy was introduced nearly a decade ago. So it is based on the evaluation of the etiologic and the protective factors, the establishment of the risk of future disease, and the development of a patient-centered evidence-based Caries management plan. So, coming to the conclusion, historically, dentists have relied on the knowledge of the disease process in combination with the experience to estimate the risk level of patient. So, it is very important to determine and prescribe the appropriate preventive and therapeutic strategies properly. So, the dentist must consider the patient's overall risk status and based on the level of understanding of disease progression and the management options should be formulated. So as certain conditions are going to place patients at a higher risk, the dentist should identify the risk factors for disease during initial oral examination, and in the subsequent patient appointments, a proper treatment plan should be